And Dr. Moloo has requested if any of you have a moment to download a survey question poll.
Got it.
I see a couple of people with phones out. That's good. Okay. Oh, great. Numbers are picking up. All right, I think what we are going to do then, for those of you that are just joining, if you have a minute to try to get the screen capture and complete this quick survey question, we will be showing this again so that you can get it after if you don't pick it up now. It's 5:32, so I do want to get started with our regular presentation, if that's okay. So let's begin. Good evening, everyone. Anna Mikage, bonjour à tous. Thank you for joining us for our second webinar of our Planetary Health webinar series and Community of Practice. Mon nom est Christina Laperle et je suis la liaison à l'éducation du Bureau de l'Internationalisation et de la Santé mondiale. My role today is to provide the housekeeping remarks. If you encounter any technical issues, our advice is to close all other applications on your computer, exit the webinar, and rejoin the session again. I would like to begin today's session with our Indigenous land acknowledgement. We pay respect to the Algonquin people who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region from all nations across Canada who call Canada home. Nous reconnaissons les gardiens des savoirs traditionnels, jeunes et âgés. Nous honorons aussi leurs courageux dirigeants d'hier, d'aujourd'hui et de demain. Questions will be answered after Dr. Moloo's presentation. You can type your questions in the chat at any point throughout the presentation and we'll track them. Or when we get to the Q&A period, you can use the raise your hand feature and we will get your question then. Ce webinaire sera présenté en anglais. Les participants auront aussi la possibilité de poser des questions en français. And then I think I have one more opportunity. If you didn't have a chance to download Dr. Moloo's survey question, give you a couple of minutes to try that. Or not a couple of minutes, just a few seconds. And we will bring this up again once more just prior to Dr. Moloo's answer to the survey question. So I would now like to introduce Dr. Mark Walker, our Vice Dean of Internationalization and Global Health. As our Vice Dean who oversees the Planetary Health initiatives at the Faculty of Medicine, I will leave it to him to provide a brief overview of our Planetary Health webinar series and Community of Practice and introduce our speaker for today's workshop. Dr. Walker will also act as moderator for today's Q&A session. So thank you, and over to you, Dr. Walker.
Great. Thanks very much, Christina. It gives me great pleasure to introduce our keynote speaker tonight, Dr. Husein Moloo. Dr. Moloo is the inaugural Director of Planetary Health in the Faculty of Medicine. He was the Planetary Health lead and we created a directorship, and he was the successful candidate. Husein, many know, he's also a colorectal surgeon with a background in QI and patient safety, and was the vice chair of quality and patient safety in the Department of Surgery. He as well has been a huge advocate with the Royal College, and they've now integrated Planetary Health as one of the main pillars of their strategic plan. And most of all, what I love about Dr. Moloo is he is a passionate leader. There's a famous expression by Descartes that says emotion comes from within and passion is inflicted upon us. And Husein has been inflicted with the passion of planetary health and trying to advocate in our community of healthcare professionals as well as in the university communities. Has done a fantastic job and super proud of him. And we'll turn it over to you, Husein.
Great. Thanks so much, Mark. And I just want to say before I get started, I just want to publicly acknowledge that this is really this position was Mark's vision and the dean's vision. So really, we'll talk about stuff as we go through here, but I really just want to acknowledge that. And thank you all for being here today. I know there's a lot of asks on everyone's time these days, and I appreciate you spending, I guess, part of your life with me this evening. Today, we're focusing on planetary health, and I thought we would kind of just talk about some simple ways to implement it, whether it's looking at administration, into your practice, education, etc. Just some quick thoughts on that. The plan is, I'm hoping keep my talk between like 15, 18 minutes. We'll have a couple breakout rooms so you get to have conversations yourselves. And yeah, and then we'll kind of report back, hopefully ask questions, hopefully have conversations, because I think those are really important. And just in case there's anyone who is here for the first time and doesn't know what planetary health is, simple definition of planetary health to me is kind of this notion that for all the people we look after, regardless of what we're doing, people need clean air, clean water, clean soil, clean food. We need clean ecosystems for those people to be healthy. And also it's the notion that we really need to think about future generations. So although, I mean, hey, we're really important, and the people we look after in front of us are really important, I think more and more we realize that for the people who are going to be inhabiting this earth after us, for them to have any chance at a healthy life, we really need to start working on this stuff right now. So with that, I mean, I know a lot of you, probably with whether I know you hopefully download this QR code on your iPhone, but on your iPhone, you probably get news feeds that bring you stuff from around the world and in Canada in terms of what climate change is doing. And we've all kind of bared witness to that. And so, I mean, a lot of us don't know each other, but I thought we would start off by just sharing how climate change makes us feel. So hopefully, if I had time to download the QR code and if we could open the polling, that would be great. I don't think mine is not open, Christina. So that was like my test from before. Okay, we'll give it like one more minute, and if it doesn't work, it's fine. We can move on. Okay, there we go. Awesome. I still have I can't do it, but are people able to answer in this? Yeah, I'm not either. Okay. I don't know if it's working. Oh, well, some people are. I don't know if we joined earlier, whether we're not able to. So so there's some answers coming through, some not.
If you need the QR code, there it is again.
Yeah. Try one more time and then we'll give up.
I think we're getting some, so.
Yeah. I'll try one more time here. Okay. Oh yeah, it's working now.
Mm.
Okay.
Cool.
So I think.
Okay, let's give it 10 more seconds, and then I think we can move on to your presentation.
Yeah. Maybe, is there some way we can save this?
I can take a photo.
Yeah, if we can screenshot that, that'd be great.
Okay. I will screenshot it very quickly.
Awesome. I'm gonna share my screen now.
Okay. All right, I will stop sharing. There we go.
All right. So there we go. So I think hopefully that's coming through okay.
That's good.
Okay, sweet. So I think, I'm sure all of you could see that word cloud. And what I think that word cloud reflects is actually a fairly prevalent feeling amongst most adults in the world, actually, around climate change. And that is this whole like anxiety, being terrified, scared. For some people, it's hopelessness. You know, I like the positive thing in there being spurred to action. That's awesome. And so I think a lot of us suffer from some level of eco-anxiety. For me, that's what kind of got me down this path of planetary health. In terms of my disclosures, I want to be very clear. I have no environmental kind of background or anything like that. This is very much, wow, there's a lot of bad things happening. And I'm going to try and get involved with it, because I can't look my daughters in the eyes very well anymore, coming to work and not thinking about this stuff. So all of us do, I think, really important things day to day. I'm sure there's people from all different fields here, and what we do every day for people, I think, is very meaningful and very important. But I think at the same time, for me as a colorectal surgeon, I'd love to tell you that colorectal cancer is the biggest thing affecting the world, but it's not. And multiple international organizations have kind of come to this conclusion, which I'm sure a lot of you have as well, which is that really climate change is the greatest health threat facing humanity. And so although there are all these different things that we do, which are very meaningful, one thing I think all of us can gather around on is the fact that we can come together and try and do something about this. And why as healthcare professionals? Well, there's multiple reasons, right? I mean, I'm sure a lot of you have seen this. If you took healthcare as a country, it would have the 5th largest carbon footprint. So we know that healthcare itself has this massive, massive carbon footprint. And you might say, well, I mean, we're Canadian, we're awesome. Like we don't have a big carbon footprint. Well, the problem is we do. And so if you rank us, we're like 2nd worst per capita in terms of our healthcare carbon footprint. Number 1 is the United States, but being 2nd worst in the world is not really an enviable position. And so we know that healthcare has a massive carbon footprint. We know that in Canada we have a massive carbon footprint in healthcare. And then we also know, and a lot of you have probably seen this as well, is that no matter what you are doing, climate change is intersecting with it, whether it is shifting patterns of infectious disease, whether it's mental health. We alluded to the eco-anxiety, but there's a host of other issues that go along with it. Whether you care about social justice, because as we all know, racialized communities, Indigenous communities, lower socioeconomic status people, they all get affected disproportionately worse by climate change. And we can extend that to low and middle income countries. I mean, I think Africa has 2 to 3% of emissions thus far. And we know that the consequences for them are going to be much, much worse than for us sitting in Ottawa today. And so the other reason, of course, I think, as we consider all this to really make this a focal point of what we do going forward, is the fact that, well, I think we all went into healthcare to help people. And knowing the carbon footprint, the Canadian carbon footprint, the intersections with health, it's hard to look at ourselves as heroes, I think, sometimes, and maybe kind of reclaiming that pathway back to why we originally were in all this in the first place, is trying to intersect what we do with the number 1 health issue affecting humanity, which is climate change. And so how do you do that? Well, one really simple thing, and some of you may have heard of Saving Us by Katherine Hayhoe. It's a great book. Katherine Hayhoe is this climate scientist. She's originally Canadian. She's at University of Texas now. I highly recommend this book. It's great. In the last chapter of her book, it says, you read all this stuff. It's great. And she's like, what can you do tomorrow to move this forward? And the one piece of advice that she has is having a conversation. And you may say, yeah, you know what, having a conversation, it's not that big a thing. You know, it's interesting. I used to think that as well, but it's amazing how much conversations actually move things. And so I like, and I think the more we talk to each other, the more we talk to our like trainees, the more we're having interdisciplinary kind of talks about this, I think the more we can, again, move this forward. And you know, one of the things in the title of my presentation is like, administratively, how do you incorporate this? Well, you know, to me, and again, for any of you who have met me, the one thing that Mark didn't mention in the intro is I'm very simple-minded. And so to me, I know there's lots of gray zones in this, but you're either in a boardroom setting visions, or you're not in the boardroom setting the vision for an organization. But I don't think it actually really matters. And I can tell you that now from personal experience, is that having conversations with, if you're in a boardroom, with the leaders in the boardroom, or, you know, we all actually have a lot of agency, and going to talk to whoever it is that you feel comfortable talking to, whether it's a conference organizer, whether it's your division head, department head, CEO of a hospital, CEO of like a national organization or international organization, I think it's fair. And the conversation pretty much goes as what I've chatted about so far. And this is kind of the conversations that I've had with, again, division head, department heads, CEOs, etc. And it goes like this. It goes, climate change is the number one like issue facing the health of humanity. We are in healthcare to help people. And we know healthcare has a massive carbon footprint. So if a division, a department, a healthcare organization does not have planetary health as part of their vision going forward, then I consider that vision irrelevant. And that may sound good, that may sound kind of harsh to you, but really within the context that we live in locally, nationally, and internationally, I really honestly believe that. And it's funny, like you may think, yeah, it's a really simple thing. Well, I'm simple-minded. This is what I could come up with. But I'll tell you, in conversations with CEOs, it's actually, and again, I think multiple people have these chats, and that's the power of conversations, but things have shifted. And I think, I really think the power of just a simply thought out conversation can be effective. So then how about what we do? And I think having a framework is really helpful. You know, I think it just gives us something to go back to. This is a framework which I like. You can pick whatever framework you like. I like this one. It's from Andrea McNeil, who's a surgeon out in BC, who's done a ton of work in planetary health. And it's very simple. Like, it's reducing demand for health services, you know, not like matching supply. So really thinking about appropriate care, and then reducing emissions from how we provide our health services. So like, what does that look like? I can tell you, like, you know, as a colorectal surgeon, you know, that looks like, well, I know that the carbon footprint of a massive operation along with chemotherapy and radiation is much more than a colonoscopy to remove polyp. So maybe we need to move things upstream in terms of screening. You know, in terms of appropriate care, I mean, you know, if you look at studies, and, you know, Mathilde, who's on this call and who's the planetary health lead for internal medicine, she sent me this article, and it, you know, it had a little stat in it which stuck out in my mind. And it was like, yeah, like 10% of care that we provide is harmful, and 30% of it is low value. So again, wherever you are, there is opportunity to try and mitigate. I'll tell you, from my own practice, like something that just came up with our fellow looking at it, is for our colorectal resections, every patient after surgery got blood work every single day. That's not necessary. That doesn't reflect best care, and it's higher carbon care. And you know, so I think, like, even though I'm really interested in this, we're still like all the time finding areas that we can try and again, like, be more appropriate with the care we provide. And then finally, you know, reducing emissions, that all comes down to, you know, looking at circular economy. So like things like using reusables versus disposables. You know, I mentioned Mathilde earlier, I'm going to pick on her again. Like, she's trying to look at something where, like, you know, when we're doing simple procedures by the bedside, man, we get these huge pans sometimes, and like half the stuff on there gets thrown out. it doesn't make sense. And so again, we have all these opportunities, and you know, as I look like I mentioned, you know, if you look at a operative or a perioperative kind of pathway, you know, even with the development of surgical disease, like I told you about colonoscopy for colorectal cancer, but then, you know, you start turning your green lens even on colonoscopy. And one of the reviews that one of the residents just finished up is, you know, what's really interesting is, and as a colorectal surgeon, this may be the one area I know a little bit more than most of you. And I'll tell you that your colon and rectum is not sterile. And I tell you this because when we do colonoscopy now, the kind of standard of care that we're trying to change is that we use water during colonoscopy, lots of water. It's the best way to do it. It's better for patients in terms of comfort and adenoma detection rate. The water we use is sterile. And the bowel prep, when people take it, they're not using sterile water. They're using tap water. And so the question becomes, why can't you use tap water? You know, and that's been blocked by every equipment company that we've talked to, saying, no, there's infectious disease problems. So we did a scoping review, and the only evidence comes from like upper GI studies, which are totally different than a colonoscopy. So again, we would have never started looking at this. There's 1 million colonoscopies done in Canada per year. That's like millions of liters of water being used. And so, you know, it's as you start looking at things, I think with this greener lens, it really gives you opportunity to implement change, but also as you implement change to tell the story, and then, you know, because this is still a fairly new but kind of rapidly kind of evolving area, there's an opportunity for you to tell stories and publish what you've done. The last thing I want to talk about in terms of just incorporating this into your practice is this, and that's like reframing quality improvement. And quality improvement is it's everywhere now. It's in every specialty, and it's something that a lot of us are supposed to, you know, report on for continuing medical education. I don't know if that extends to other, you know, other medical or other healthcare disciplines like pharmacy, et cetera. But, you know, the value kind of proposition, or the equation for quality improvement, used to be outcome for patient over economic impact. It's very simple. You improve the outcome for someone, you decrease the cost, that's quality improvement. Well, in the NHS, they created what's called this triple bottom line. And on this triple bottom line, it's still the economic, obviously the financial impacts are still really important, but you incorporate the environmental and the environmental impact and social accountability as part of that. And so when you look at that, you go like how does that work? Well, you know, take the reducing blood work, for example. You know, there's obviously you do less blood work, it costs less to the system. You do less blood work, you're using less plastic vials, all the syringes, all the like tourniquets. That's the environmental impact in terms of all the waste that's created. And then from a social accountability, you know, portion, people don't like having blood work, and it can create anxiety. And then some of those values, which may not be necessarily, you know, like clinically relevant, all of a sudden create anxiety as well. So again, you can start looking at different activities, applying the triple bottom line, and it's a great way to incorporate this into whatever you do. And you know, some examples of that, you know, we in surgery, I always use this example. This was led by Dr. Vigils, one of the urologists. You know, look, we used to be on paper faxing, switched over to digital faxing because of a variety of good reasons from a quality improvement point of view. But it was driven by like reducing our environmental impact. And that's really what was the hook for our departmental members. And when you look at this, I mean, it spread after the initial kind of trial period in urology. Once we presented it to our divisional QI leads, that just took off. And the big hook, again, it was like, you know what, people want to do stuff. The vast majority of people have some level of eco-anxiety. It was help from that word cloud. They want to do things. And if you give them the opportunity to, you start seeing results like this. This was led by Mary Hannah in anesthesia. Desflurane is this anesthetic gas that has 2,500 times the warming capacity of carbon dioxide. And there's no reason to use it, really. And so you look at what anesthesia has done, and like, you know, desflurane use has almost been eliminated, and like their carbon footprint as a result has been dramatically reduced. And it, you know, again, you look at any area, like when you start turning on this lens, you look at food waste, like 50% of food in hospitals is wasted. That is like a massive waste of resources. That's a study up in that corner is from UBC, where looked at patients. They're basically there's about a kilogram of food waste per day per patient. Again, there's the blood work stuff. Here this is Eugenie Waters, one of the family physicians, who doesn't use paper on the examination table anymore. Diagnostic imaging, like it doesn't matter where you go. Like I know the pharmacy group here has been working with the internal medicine group in terms of like trying to reduce the meter dose inhaler use, because each of those little inhalers is the equivalent of driving like 300 kilometers in a car. And like there are alternatives which are very good and dramatically reduces that. So again, like it's really interesting to see how things evolve. And if you're a trainee, you can lead stuff too, and do these kinds of things. One interesting thing, again, using a QI approach, was this. This is out of Australia, and they started at the beginning of the pandemic with like 3 anesthesia trainees who like wanted to do something, and so they started trying to reduce blue pads use in the OR, which are disposable, and you know what? Over 3 years, they've grown to like 500 trainees involved in 100 different centers. And that's because everyone actually wants to do something. A lot of people are just looking for how to do it. And so again, our residents here are doing something. And so now, the Australia thing was called Trash. We chatted with them. They came up with this name, Trash Can, for Canada. And so, we have now we have leads, like we have faculty kind of mentorship from surgery, anesthesia, internal medicine, and we have resident in each of those areas who are willing to partner on this. We've got some initial projects that are going to start out. Again, being led by trainees in terms of decreasing blood work, in terms of bringing your own reusable bag to the hospital, because when patients come for different tests, they're given plastic bags. And now within the context of us trying to reduce single-use plastics in our country, this kind of aligns very well. And again, dramatically reduces carbon footprint, because it's amazing the hundreds of thousands of plastic bags that get used within a healthcare setting. So, again, it's a great way of incorporating into like the whole educational platform, because all programs need to do some kind of QI thing. I know the pharmacy, inhaler project being led by, a pharmacy resident, but being supervised by one of the pharmacists, Shalisa. So again, like it's pretty cool to see this happening. And part of why we want this webinar and have set this up is we want you to chat with each other so you get to know each other. And I think a big part of it is just trading ideas and making things happen. I can tell you, like, from a personal, like, again, like, I'm a pretty simple-minded guy. I have no background environmental anything, but it was just like like I was leading QI in the Department of Surgery, and I realized, like, wait a second, like we were trying to intersect with major societal issues, and obviously the climate crisis is one of the big things. And as I started reading about it, I realized there's all this stuff out there, and then I just started having conversations because I just wanted to find out from people who knew stuff that I could learn from and then do more stuff. But it was, like, it's evolved into, our Ontario Surgical Quality Improvement Network. That's over 50 hospitals doing like 75% of surgery in Ontario. In April of this year, the theme that we're choosing for that whole network is Planetary Health. CanMeds 2025 is going to have Planetary Health in it. So it's coming to your, training program, regardless. And again, like Ottawa, and I think like Ottawa in general can be real leaders in this. And the American College of Surgeons, I went to them because I thought maybe they'd be doing something, but they were doing nothing. And so again, working with them on their strategy. So I think, I know I see names on this call and people like who have done more than me, who are smarter than me. And so there's like, I think there's so much potential for us to really move things forward. And, I always like to finish off with this quote, because I think it rings true in this space more than any other. And that is, I like philosophy. So this is a kind of a modern Canadian philosopher, Marshall McLuhan. he says that, on Spaceship Earth, there are no passengers. We are all crew. And I mean, with what's going on in the world today, I mean, I think that kind of thinking is needed more than ever. And as healthcare professionals, I think we need to be leaders in this area. So that's all I have to say. We have some breakout rooms. Again, thank you so much for coming out this evening. Really appreciate it. So Christina,
Yes.
can I hand it back to you for the breakout
Okay,
groups?
if you want to stop sharing, and then I will share.
Yeah, sure.
We don't have piles of time for breakout rooms. So what I was going to suggest perhaps is that we put all the questions into one breakout room.
Sure.
And then we can do it that way. So let me share my screen.
Sorry.
Can you all see that?
I apologize.
Breakout room, discussion 1. So we're going to try and cover as many of these as possible in the one conversation so that we have time. I think it's important to also come back and share with each other. But brief personal intro, what's your role in the healthcare environment? What planetary health project are you working on or hoping to implement in the next 12 months? And if you have no project, that's okay too. And then our second breakout room questions was, what barriers to your work do you foresee? What facilitators are currently present? And what can the Faculty of Medicine do to help? And I know that Husein, this was particularly important for you and me, because part of this webinar series is about making sure that we get you the tools you need. And if not in a webinar format, we want to put it on our Planetary Health website. So please be sure to talk about these. And
can we give like 12 or 13 minutes instead of 10?
Yep, that's fine. And then we'll put you in the breakout rooms, 4 breakout rooms with about 6 people, and then we'll call you back.
Awesome. All right. Do we have everyone back?
I think so.
Back.
Okay. Perfect. All right. First, I hope that was good. Because there's a lot of cool people on the call. So I can't imagine how it would be. And so basically, I can't remember what groups people are in, but if we could, I know there were 3 groups. If we could start with, I don't know, and I don't know if if you're in group 1, 2, or 3 either, but hopefully you do. But if we could start with someone maybe from group 1, and if you could just feedback on kind of barriers, facilitators, stuff that the Faculty of Medicine can do to support you and your projects, anything else that came out of the group that you think is interesting. Anyone from group 1?
I can go ahead.
Yeah.
I was in group 1, so I'm Daisy Morris, family medicine, and we had it. I'm not sure if our conversation was as focused maybe as some of those things you're saying, but we had a good conversation. We represented a interesting mix of different disciplines, including non-clinical scientists as well, and so we had some good chats about some of the things that we've all thought about in terms of reducing waste and use, both here and overseas, because one of our members is from another country and is here. And so talking about getting that kind of approach started in a place where there's not much movement on that yet. And I didn't want to speak to that. It wasn't my conversation, but that was a neat part that I hadn't thought of. We talked a little bit about some other projects some of us have thought of doing. A new build for our GN research tower. One of our group members talked about conference travel, and thinking about some work in encouraging reducing conference in-person attendance. So it was I felt like it was a good conversation, group 1. I hope you all agree. We sort of chatted about different things that we all were thinking about and getting excited about.
Awesome. Just, was there anything, I guess, that people, and I maybe didn't come up and that's fine, but things that as a Faculty of Medicine could be done to support, people like you who are trying to do things? What can we do to make sure that you're able to succeed in what you want to do?
It was not something we directly talked about, but I think in some ways this actually represents one of those things, because we just put 4 people who don't, well, James and I know each other just socially, but who don't really know each other, who never would have a conversation with each other, probably because we wouldn't cross paths, and talked about different things and ideas that we wanted. So the networking aspect, I think that's my first thought of what this has and can accomplish. Anyone else in the group have any thoughts on that?
See, James got his hand up there.
Yeah, so can you hear me? Yeah, so one interesting thing, so getting back to the idea about reducing in-person conference travel. So that's something I think we should be trying to do. And yet I'm mindful of how the Faculty of Medicine for physicians on an academic track who want to be promoted, presenting research, being an invited speaker at national or international conferences is, one of the things you have to do on your pathway to academic promotion, which I frankly think should change. I don't see why that should be part of it. I mean, I think we should take an ethical stand against that being part of it.
No, that's a really interesting point. And, at NOSM, like the Northern Ontario School of Medicine, they've actually discussed that and incorporated that into like as a change that they want to make in terms of promotion. Mark, I know like you're someone who could be promoted like 800,000 times over, and also are at these like important like kind of executive level meetings. Like what do you think about that?
Yeah, I know it's a good suggestion.
Okay. And like, can that kind of thing happen? Like, how does that change? What would be our pathway?
I
know, putting you on the spot, man. But so that we can take back for sure.
Can I say it's Paul here?
Yeah.
So maybe I'll help Mark out a little bit. So it seems to me that the issue here isn't the promotion, and because there's some sense that we have to be able to demonstrate scholarliness. I mean, that's what criteria for promotion. I think what we're talking about here is the traveling to conferences, because there are electronic solutions to all these things. We're demonstrating it right now. So we have a very, the office has a very robust conferencing platform that essentially can mimic all the features of a conference, even the networking. But unfortunately, the networking requires a Zoom call like this, and people just aren't used to doing it. So you can network; it is possible, but we just haven't been socialized to that. But people, I think, have gone to Zoom kinds of conferences. You can have plenaries and breakouts, just like you should demonstrated. And so you can have the conversations, you can present your work, you can disseminate, which is essentially the features of scholarliness. And so I think it's not the promotions necessarily. I've just add to the conversation. So it may not be the promotions that's the issue. It's how we disseminate. And I think there are digital ways of doing that have a low carbon footprint. And we just have to adapt to that and encourage that kind of format a little bit more, knowing that as social animals, we like to interact, we like to network, we like to have the sidebar conversations, which are still fairly challenging using most of these platforms. But anyway, I think it's an evolutionary thing. And then if we pull, if what you're saying, if we're doing what you're doing right now is raising the bar, pointing things out, pointing these issues out, then that might drive us to be more environmentally friendly when we think about traveling around the world to a conference to present. So I agree with you fully in terms of the conferencings, but I think there are other ways of doing it that may be a little bit easier to take and much better for the environment.
Yeah, thanks, Paul, for all those comments. And for those of you who don't know, like Dr. Henry kind of oversees all the CPD stuff and also is involved with like all like a lot of national international conferences that get organized through U Ottawa. So your comments are very well taken. Thanks Dr. Henry, for that. Christine, I think I see your hand up.
Yeah, no, I just wanted to, the one thing that the faculty can certainly do going forward with new builds is to make absolutely sure that there's adequate facilities for recycling everything, including obviously glass washing for reusable pipettes, which is something we use in huge numbers, huge amounts of stuff that gets thrown out. I'm sure it's very similar in clinical practice where everything comes in a plastic pack and you open it up and you use it once and you throw it out. So that's gotta stop.
Yeah, no, I think you're right. That reduction is a massive like reducing like the disposable is a massive problem. Even like I mean in the operating room and elsewhere, like there's so much disposable stuff. There's been such a shift towards disposable things, and it continues even like in more and more astounding ways. Actually, like there's now scopes that are being built that are one use kind of scopes on the name of, you know, infection control, and it's not a sustainable practice. So no, I hear you, and that's, I think, really.
I think it's pretty easy to figure out whether or not people, you know, developed sepsis back in the 70s before before all of this was so easily disposable. So yeah.
Yeah. No, for sure. Now, anyone from group 2 and 3? I'm sorry, I know we're like running out of time here, and I want to respect everyone's time. So, but I do want to hear from those groups of, Amr.
Yeah, so we had a good discussion. I have to be honest, we didn't stick to the questions that you guys put in the chat, but it was interesting. So we spoke about just questioning what we do to start. I mentioned a study that I published in August looking at post-op labs with one of the residents that we have at the general surgery program. And we talked about how we were looking from a patient outcomes, but there was a planetary aspect to it. So we saved 512 tubes by canceling POD blood work for our bariatric patients. And there was no effect on patient safety. So it had multi-effects on the system, from cost, planetary, so environment saving, and also patient safety, plus patient satisfaction. We didn't measure that very accurately, but patients were smiling when they left much earlier and without getting poked. And then we have, sorry if I mispronounced your name, is that Niamh Sega? She talked to us. You can tell us, you can tell Dr. Moloo and that's everyone else about the part you mentioned.
Well, Dr. Moloo is very aware of what I do.
Okay.
Yeah, so I guess like we all started to talk about the fact that evidence really makes a difference in planetary health movement, and talking about that study. And then we're working on kind of changing the gowns from disposable to reusable, and always having to find that evidence that shows us that what we're doing is actually putting like being better, both environmentally and financially, and also for the patient, right? So talking about that triple bottom line and how we can have some pushback for small things in planetary health, unfortunately, but using that evidence really, really helps to kind of decrease that pushback and show that what we're doing is actually the better solution, and then go from there.
Yeah, and Niamh's done great work. Like she's the one really leading the charge on switching from like disposable to reusable gowns. And initially the hospital, when I had chatted with them, had said there was like a $2 million per year increase using like if we switch back to reusables. But Niamh kind of really met with a lot of people, and it's actually cost savings. And no one actually can remember why it got changed in the first place. It's like this. It's incredible. I mean, it's another story for another day, but it's pretty incredible the work you've done, Niamh. So, and hopefully it'll change practice here. So, okay. And anyone else? Like I know we're like at 6:28. Any other comments anyone had?
I think I have a quick comment just about conferences. So there is sometimes pushback from the organizers of conferences to present in person. But I noticed in one of the conferences that I went to a few months ago, they actually rolled back some of their digital technology. So we used to present posters on a TV screen in person. And this year specifically, to drive people to come in person, they said everyone has to print their posters. So that was an interesting way that they, and I think that's an aspect that we could push back on as presenters to say, you need to at least have those screens. I know in general surgery, that's what we do. There are screens and we just present them digitally, but I had 3 posters and I threw them out in the garbage like 2 days ago after my conference. So that felt bad, but sometimes it's the people organizing the conferences that can do their part too.
Yeah, no, thanks. I agree. And I think it just speaks to the fact that wherever we look, there are places that we can advocate and things that we can change. And I think, you know, I know we've kind of run out of time here, but again, if any of you have ideas, any of you think of ways in which the faculty can help with your mandate or advocacy more, please reach out. I'm happy to chat with anyone. As you could tell from my presentation, I love conversations. So I'm totally happy to, you know, have a conversation with any of you. And a template for us. A template for what? Can
just
I
guidance?
Guidance?
Yeah,
okay.
just some guidance.
You know, if you can email me more about specifically what you're looking for, I'll be happy to follow up on it. And yeah, for sure. I'm happy to that's what I'm here for, and to work on stuff like that. So please email me kind of some details of what you're looking for, and I will work on that. You know, again, we have this webinar series. We're hoping you'll stay engaged. We have some really good speakers coming up. Our next one is Melissa Lem. She's awesome, and she, you know, she's part of this whole nature prescription, which started in BC and has spread everywhere, been featured on CNN. She's the president-elect of, or is she now the president of CAPE? So she's amazing. And I think, you know, she's a really good presenter, and I think everyone will really enjoy her talk. So that'll be in the new year. There's these activities which we have for the community of practice. Remember, if you attend all the webinars, do some of these, they're really quick. You get merch at the end, little pin that you can put on your lanyard, which is really cool. And then the video is really good. It was a webinar we did before, and it really highlights what some of the people here in Ottawa have done really cool things. So I'd encourage you to check that out. I think that's it. Anything else, Christina, that I need to go over before everyone can go back to their lives?
No, I think we were going to talk about the bright space, but I can just email everybody about that. It's probably easier. But if any of you are if you are in the community of practice, as opposed to just watching the individual webinars, then I will reach out to you about getting onto the bright space to access the videos and complete, because we want to have an online discussion. Obviously, we have today in-person or virtual discussions, but we also have a written discussion forum on the Brightspace tool. So that way we can continue the conversations. But in the meantime, this is the Planetary Health website that you can all visit. We have a great video, as Husein mentioned, the physician role in climate emergency. So this is with a couple of our participants here today, Dr. Eugenia Waters, Dr. Jocelyn Anderson, and Dr. Curtis Lavoie, and even one of our UGME students, Harry Wong, speaks about what can be done. So lots more ideas from within our own community. If you want to find that, that's on the Planetary Health webpage here under News, Events, and Archives. And I guess we can handle the rest. So by email. So any questions, you can write to us or Husein.
Yeah, please reach out. Be happy to chat. Anyway, hope you have a really good evening. Thanks so much for joining us. And listen, happy holidays and happy New Year to everyone. And we'll see you in the new year. Take care.